The Nigerian Center for Disease Control and Prevention says the country is expecting 10,000 doses of the genius vaccine as it considers the vaccination for high-risk groups for mpox.
It is also intensifying surveillance across the country to safely detect and respond to the new cases of mpox. This comes after the World Health Organization declared the disease a public health emergency of international concern on Wednesday. We want to actually warn that some of these visuals are not really pleasant to the eyes.
Mpox cases is due to a new strain of the virus which emerged in eastern Congo and has since been detected in Kenya, Rwanda and Uganda. So far, about 2,863 confirmed cases and 517 deaths across 13 African countries have been reported this year alone. In Nigeria, a total of 39 confirmed cases with no deaths have been recorded across 33 states and the FCT from January this year.
The virus has been detected here.
The Nigeria Center for Disease Control says it is putting all port health services across all 5 international airports, seaports and land crossing borders on high alert.
We are working with the port health services. Along this line, 5 designated international airports and some key seaports, including land and foot crossing borders, have been placed on high alert. Declaration forms have been distributed to airlines, especially those coming in from countries where there is an ongoing outbreak of mpox in the last 90 days. Treatment protocols and diagnostic tool protocols according to the IDSR are now distributed to various states. All states have also been put on high alert, including Lagos, Abuja, Enugu, Kano, Rivers State, Cross Rivers, Akwa Ibom, Adamawa and Taraba.
The Disease Control Agency also says the National Mpox Technical Working Group will continue to coordinate mpox response activities across the country.
The exact reservoir of the virus is still unknown, although rodents, squirrels, and monkeys are suspected to play a part in transmission. The mpox virus can spread from both animal and human, and animal to human, and also from human to human.
The World Health Organization had declared the ongoing mpox outbreak as a public health emergency of international concern just about 24 hours after the Africa Center for Disease Control declared it a public health emergency of continental security due to an upsurge of cases in the Democratic Republic of Congo and a growing number of countries in Africa.
Early intervention and educational services combined with support networks has led to huge improvements and some progress in the lives of children with special needs. The Stella Obasanjo Child Care Trust has been doing this, and it is one of the legacies the late former First Lady left behind for Nigerians. Many decades later, after Stella Obasanjo's death, the trust still stays strong.
The center is doing a lot in catering for the welfare of children with special needs, Down syndrome, autism, cerebral palsy, children with disability, and also many of them. It was recently relaunched with support from the Petra Speech and Early Childhood Developmental Center, which will be assisting the center on technical expertise to support in creating awareness and visibility as it seeks to support from parents and the government to address some of the challenges plaguing the center. We are now joined by the founder of Petra Speech and Early Childhood Developmental Center, as well as the child care experts, Princess Inwakego Ibrahim Pan. Welcome to the show.
Thank you very much.
I hope I've got your name right.
Yes, you did.
Okay, so let's just look at these issues. Tell us why you decided to take up this job first as the home mother of the center.
I've been in the special needs education field for the past 30 years. And then I had to relocate outside the country with my husband, which put a break to the work I already started in Nigeria. Far back in 1994, we were one of the first people who went into special needs education due to my training as an English linguistic graduate from the University of Jos. And so, and since I left the country, I've been practicing the special needs work in different continents, in North Africa, in Europe, in Asia, and now trying to establish in the US. But I came back home for a vacation, and a friend who happened to be the wife of an ambassador, we lived together in South Korea. She had wanted to celebrate her birthday at the orphanage or special needs center, and she invited me, and so I obliged her. And it happened to be the Stella Obasanjo Child Care Trust Center. And when I went in there, I fell in love with it. Why? It's the kind of structure I've been dreaming about to establish for the past 20 years. So I said to myself, if this kind of structure exists, why want to start something when there's an existing structure? Why not upgrade it, make it to be like a pilot project for what I intend to do? And so that was the beginning of negotiation with the center for the past. We started talking about 2 years ago when I went for the birthday with the director, and then 9 months ago it went to the other level of signing an MOA with them. And so Stella Obasanjo, former First Lady of the Federal Republic of Nigeria, had a vision. A vision at the time she had it, very few people could align themselves to what she saw. And here we are, almost 20 years after her death, and special needs education is coming to the fore. And so I'm just somebody who believes in building on what somebody built on that aligns to my vision. She just was building that place like it was in my imagination. So that is the affinity I have with the place. That is the passion I have, that we share something in common, the love for special needs children and their families. So when we talk about special needs, we're not just referring to the children. It's a holistic community we have there. They have siblings, they have parents, and they have friends. So at this Stella Obasanjo Child Care Center, my aim is to bring in the expertise that the children need, the early intervention that can actually make them more functional in society and be more beneficial to themselves.
All right. So, well, I think in some other interview you had mentioned, you know, that the center could take 120 children.
Exactly.
But presently you have about 26 children.
Exactly.
And so now, are you asking for more? You know, what's inspiring this relaunch to ask for more children to join the 26 that you already have?
I'll start with, I'm somebody who don't like doing things in a grandeur fashion. We need to meet the need of the 26 children right now. From what we've been working on, the 26 children at the center are not properly fed, number one. Their accommodations are not in good condition, number two. The classrooms are not properly furnished, number three. They don't have the clinical equipment and assessment centers they need. They need a therapeutic center, non-existent. They need the language center, non-existent. They need a clinic, because right now as we speak in the medical field, very few medical doctors know how to deal with the special needs children, exactly the protocol needed for them to get to where they should be. So the essence of this is to relaunch the center, to try to equip it to an international standard. And once that is done, then we'll have the capacity. There's no need bringing more children when the children in the center already are not having the full benefit of the structure that is in existence. So the relaunch on the 22nd of August is to ask stakeholders, to ask families, to ask friends, and to ask people that have the means of making that center to an international standard to come and join us on Thursday, to come and contribute their quota in making sure that we turn that center, the Stella Obasanjo Child Care Center, into an international pilot project for other special needs institutions around the country.
So, you know, one of the issues that we face basically in the country is the issue of inclusion.
Yes.
You know, and it's a big one.
Yes.
Not just with, you know, people with special needs, people with disabilities, you know, even during election we also find all of these things very, very critical.
Yes.
So how much more can we begin to have a sense of inclusion for these people with special needs?
Right now, I've been on this for quite some time. Every year I came back to Nigeria for the past 6 years. I go around different institutions that have maybe a department of special needs or one classroom for special needs. And the truth of the matter is that we have not yet mastered what inclusive education is all about. People think that because you have a regular school and you have one class for special needs, then you are inclusive. No. Inclusive education means how do the special needs children and the regular children interact daily through their schoolwork, through social skills, through emotional interaction. There are schools that have special needs classes that are still exclusive because they do not have the curriculum or the skilled teachers to integrate both regular kids and the special needs children together. So what we're trying to do in Stella Obasanjo Child Care Trust Center is to start an inclusive setting. We're asking regular kids from nursery to primary 3 because we don't want to do it to primary 6 yet, because the children we have there, even though some of them are 30, 28, 22, they have the capacity of 3-year-old, 6-year-old, 9-year-old mental age. So we want to bring those children of that age, mental age, with the children already we have in the center, so that we can infuse them into regular setting. And at the same time, that is why we're asking for a therapeutic center. So 2 or 3 hours of the week, we extract them and give them the one-to-one teachings they need at the therapeutic center.
Okay, so I mean, earlier you had enumerated a good number of challenges that the school have, which is the reason why you're limiting it to the number that you have now until the relaunch. We're all hoping it's going to be a success. And now my question is, in what ways, how can people partner to achieve this? That's one. And then also, you know, what kind of benefits can we get if these special needs children are taken care of? Because I think those are kind of things that would motivate one to want to be a part of this.
Thank you for that question. How do we benefit as a community,
as a community,
as a society? I'll just give an example of what happened 2 weeks ago when we were having a training session. A parent, a husband and a wife, and their 9-year-old daughter came in for a place for refuge. Since she was born, her mom had not worked for 9 years. She's lived her life for the 9-year-old daughter. And now she has a medical situation that she needs to be operated on. So they came to the center in the hope that we run for the year to drop the child, because there's no other caregiver at home or anywhere else that would take care of this child, for the mother to go for this needed medical surgery. One, the effect of having a special needs child in a family not only affects a family economically, it affects them mentally. It takes one of the parents to give up their life to be able to take care of this child. So when you multiply that, right now as we speak, we have about 6.5% of our population that are special needs children. If you multiply that by 25%, you can imagine how many families, as we're speaking right now in Nigeria, that are suffering from economic hardship, not because they do not have the qualification to work, but because they have a special needs child that they need to cater for 24/7. So that is one of the impact in society. Right now as we speak, we have 99.5% of the special needs children that are not in school. I say to people, special needs children are not different. They just learn differently. If they are properly taken care of, if early intervention are given to them, we'll have them to do minor things where they can create income for themselves and their family and support their family. But because we have not gotten it right, they seem as if they are a burden to their family. So the key here is getting the protocol for the special needs children, right? Early intervention, policies and regulations that provide the fund that makes these establishments that take care of these children to function at the capacity that we can see the result.
Thank you very much.
Thank you so much for joining.
Thank you.
I think the discussion kind of made me a bit emotional.
Yeah,
Thank you very much.
Thank you.
We'll take a break. When we come back, we'll say more.